celebs are putting their best face forward as they walk the Golden Globes red carpet. So how do Hollywood's biggest stars prepare to win over even their harshest beauty critics? And how can we get the same results? Plastic surgeon Dr. Stephen Davis has the latest trends in non-invasive treatment. So we're going to talk about procedures, maybe what pain, price, products, everything.
All that stuff.
Okay, let's start here on the end.
Okay, so, you know, imagine you're getting a phone call or you find out that you've just been nominated for a Golden Globe and you have like less than a month to get this whole thing together.
Correct.
Okay, so one of the first things, let's take some different celebrities.
Yes.
So Emma Stone.
Emma Stone.
Beautiful girl, beautiful eyes, right? Mm-hmm. But if you take a look at her photos, one of the things that she always seems to highlight are her lips.
Okay.
So we now have a brand new FDA-approved product that's called Volbella.
Yes.
And it doesn't give that duck lip appearance.
Okay.
It's a very natural way of making the lips look nice and plump and juicy. But if you didn't want to use that kind of a thing and you just want to do something at home, there's a product now that also causes those vertical lip lines and those things that just make the lips look older to just look more juicy and full. And that's by New Genesis, and it's like a lip plumper.
Okay, so that's a cheaper alternative.
That's a cheaper alternative, absolutely. Next one is, let's talk about Meryl Streep. Okay,
I love her.
So she's an unbelievable actor, right?
Of course.
So you don't want to stop her from emoting any expression. But if you take a look around her eyes and things, she could use a little bit of something for her eyelids and around the crow's feet. Okay. So we've been using, as plastic surgeons, we've been using Botox for so many years now that you really can precisely put it exactly where you want. We can give her an eyelid lift in like a week, it's done.
Oh, wow.
If you don't want to use something like Botox, there's a product by L'Oreal that's a Revitalift. And again, you may need to use it for a few weeks in anticipation of this, but you'll start to notice fine lines and wrinkles start to go away.
Okay.
You give a little lifting to the eye.
Let me ask this, because I know women want to know pain. When you think needles, does Botox hurt? I've never done it, but I've heard I might start needing it here
If you put a little topical numbing on the area, it'll take a second and it'll feel like a little bee sting for a second.
Gotcha.
That's it.
People use that for tattoos as well. Numbs it right up.
Exactly.
And then going,
Gotcha.
How about that, too?
Viola Davis is another person that we've just been looking at different celebs to give an idea about what they could do to like just get things looking sharper.
Yes.
Right around the jawline and the neckline, if someone's starting to develop a little bit of fat, jowling, there's a product that's, again, recently FDA approved called Kybella. And it's a way of dissolving fat. And again, it's a little needle stick, but it works.
Sounds painful for me.
I know you don't like that. So, if you don't want to do that, we have something called Nectafirm.
Okay.
It's a cream. You apply it to the area, it makes the skin start to get tighter. Looks really good.
How long?
That's what I'm saying. You need a good month of this. That's what I'm saying. If you're getting that Golden Globe, phone call,
you got to get it a month in advance.
Exactly.
Okay.
Now,
Denzel.
Denzel. One of my favorite, right?
Me too.
Right, okay. He may have put on a couple little extra little bit of fat around the abdomen, around the love handle.
He said that, Denzel.
I did.
Not me.
But I've developed this technique, literally, where we can liposuction away fat from a given area in literally less than an hour. It's called Flash.
So you don't have to undergo and do all the.
No.
It's like spot treatment.
Spot. And literally, these are the instruments that I use to make this go away. It's a syringe, and it's a little tiny coffee stirrer type of thing, and you can see it has a little opening at it. And again, it's a way of being very precise about where you're going after that fat.
Wow.
It's done in less than an hour.
Pain?
I call it Flash. No. Again, it's something that's with a little bit of like a numbing cream and a little bit of Novocaine, you're done. But let's say you don't want to do that either. Something like this product by Vaseline, it's like a renewal type thing. It makes the skin appear tighter and firmer, has a little bit of caffeine in it, so it's just causing a little constriction of the area. It's not a permanent thing, but the lipoing is
a more permanent.
I just want to point out, I've been using this for about 8 years now.
And look at him.
Look at him.
I feel like Denzel.
Okay, last but not least.
Okay, so we were looking at some other actors. Jeff Bridges.
Yes.
The dude.
Great guy,
the Big Lebowski.
right? But if you take a look at his skin, he could use something to just make it look a little bit more refined.
Okay.
He's not going to do anything that's nutty, but we now have something called a light laser peel.
Okay.
Not painful at all.
Okay.
Again, it's within a week. The skin, and that's why I brought this in, literally kind of peels.
Oh.
off. And all the dead, dried skin comes right off. So it looks like it's brighter, fresher, and just like, you know, a little bit more sharp when you're going down the red carpet.
Nice.
Again, if you don't want to do that, we have pads. It's made by me, Davis RX.
Look at you.
Well, you know what? Guys don't want to do anything. You know.
It's fair.
These are pads. You take them out at night, you rub it on your face. Within a week, all the dead, dried skin is off, and you start to look as good as this guy
I'm
right
getting
there.
married in 2 months, so I might have to put this in the pocket.
Yeah, he's already
Just
looking
saying.
good.
Dr. Davis, we love you and appreciate you. Thank you so much.
Thanks.
All right, we're going to take a quick break, and we'll be right back.